During the Middle Ages, it was believed that the mentally ill were possessed by the devil. In today's world, the stigmatization that surrounds sexual deviances and mental illnesses have shifted. The diagnosis of sexual sadism has been surrounded with a significant amount of controversy over the course of several years. It was a prestige German psychologist that went by the name Richard von Krafft-Ebing that invented the term sexual sadism at the end of the 19th century. Sexual sadism disorder is when an individual receives pleasure from inflicting physical or psychological suffering on another person. In theory, a sexual sadist only receives gratification from their behavior if the victim experiences fear, pain, and humiliation. Although almost everyone has sexual desires, some may be considered abnormal. The causes of sexual sadism have yet to be determined, but researchers suggest that neuropsychological, biological, and environmental factors that the progression and development of this type of disorder. Furthermore, studies have proven that temporal lobe abnormalities are sometimes associated with sexual sadism. However, it can be concluded that there is not enough decisive evidence to support what triggers or causes sexual sadism disorder. The DSM-5 gives clear and concise criteria for the following mental disorder to be diagnosed. Symptoms must be present for over a period of at least 6 months, recurrent and intense sexual arousal from physical or psychological suffering of another person, as manifested by fantasies, urges, or behaviors. The individual has acted on these sexual urges with non-consenting person, or the sexual urges or fantasies cause clinically significant distress or impairment in social, occupational, or other important areas of functioning. Prevalence varies broadly from around 2% to 30%, depending on the nature of the criteria for sexual sadism disorder. In the United States alone, sexual sadism affects less than 10% of sexual offenders. The rate of sexual sadism disorder among those who have committed sexually driven homicides ranges from 37% to 75%. Individuals with sexual sadism will almost never seek therapeutic treatment because of the fact they do not characterize their condition as being atypical sexual behavior. Historically, sexual sadism and pedophilia was treated with castration. However, this was only for serious repeat sexual offenders. There has been rapid changes in the course of treatment for this disorder. There are some treatments that have shown to successfully treat sexually deviant fantasies, urges, and behaviors which can either be eliminated or suppressed. Cognitive behavioral therapy, acceptance and commitment therapy, and medication have all shown to be effective forms of treatment.